present as it is means bilateral presentation, and males are most commonly affected. And etiology, the main deformity which are present in CTVR, we can remember by naming cave, cavus, adduction, varus, and equinus. So the deformity are present due to the contractures of the muscles. Muscle contracts, that's why these deformity are there. So this cavus means the medial arch of the foot will be more like this, and the adduction will be means the foot will be in adduction. Varus means inversion of the foot will be there, and equinus means the plantar flexion will be there of the foot. So the cavus, it is mainly due to the contracture of the flexor hallucis longus muscle. The adduction will be mainly due to the tibialis posterior muscle contracture. The varus will be due to the tibialis anterior and tibialis posterior muscle contracture, and sometimes also due to tendon Achilles tendon. But the equinus is mainly due to the tendon Achilles tendon contracture. So this deformity are due to this muscle contractures. Also the bones are affected. Means talus is affected, calcaneum is affected, and cuboid and navicular bones are affected. Normally this talus will present like this, but in CTV talus will be medially rotated and plantarly deviated. Also calcaneum will be in varus, and cuboid and navicular bones are also inwardly rotated. So what are the CTV is associated with other things also, like some syndromes are there, pediatric syndromes, Kuhn-Belley syndrome, Larsen syndrome, and some other syndromes are there. It is associated with that. So clinical features, it is a clinical diagnosis, and at birth the child will be having small foot, and also the calf will be also small, and the deformities which are present, this cavus, it is mainly this. Our forefoot is divided into foot is divided into forefoot, midfoot, and hindfoot. So this cavus will be present at midfoot. This adduction deformity is present at forefoot, and this varus and equinus will be present at hindfoot. So diagnosis is clinical. We don't need to do X-ray, but even if we do X-ray, that talocalcaneal angle, which is normally 20 to 40 degree or 25 to 50 degree, it will be decreased less than 25 degrees. And we can also do ultrasound. Before birth, we can go for ultrasound to diagnose this deformity. So, and coming to the treatment, as sir already told, we can first go for non-operative treatment like Ponseti method of serial manipulation and casting. So we can try this in between 1 to 4 months, and if this condition not improves or deformity still persists, we can go for posterior medial soft tissue release, and after that also if deformity persists, we can go for triple arthrodesis or other bone procedures, and after that we can go for salvage procedures. And the complications of this includes, it may after some time it may develop into rocker bottom foot. Also it may cause talus avascular necrosis, and also it may cause base cavus deformity.